Hi, my name is Courtney VanErsvelde, and I chose to do my mental health video presentation over factitious disorder, otherwise known as Munchausen syndrome. What is Munchausen syndrome? It is the deliberate fabrication of symptoms or self-injury with obvious external reward or gain. The reward or gain of Munchausen syndrome is not a physical or monetary reward. They present themselves as sick or impaired for other reasons. Although the other reasons are not always obvious, they assume the sick role to gain nurturance, comfort, and attention. The DSM-5 categorizes Munchausen syndrome under somatic symptom disorder. There are 3 severity ratings of somatic symptom disorder. The first one is psychological, when the patient presents to the clinic with psychological symptoms. The second is physical, when the patient presents to the clinic with physical symptoms that they have inflicted on themselves. And the third is combination, where they are presenting both psychological and physical symptoms. Classic symptoms or characteristics of someone who presents Munchausen syndrome. Sometimes symptoms can be fake or also induced. The symptoms may be described to the healthcare provider but not present. These could be symptoms they say they are experiencing at home or outside of the clinic. Induced symptoms would be things that they are inflicting on themselves. These would be things such as poisoning themselves to make themselves vomit, injecting themselves to cause an abscess, or falsifying lab results. Some characteristics of someone who exhibits Munchausen syndrome would be such things as someone who is very intelligent, resourceful, and sophisticated. These patients must have extensive knowledge of medical terms and diseases. They seek treatment from multiple different providers and are possibly even using fake names from provider to provider. They are reluctant about letting providers talk to family and other professionals. When caring for someone who has Munchausen's disease, it may not be uncommon to see multiple surgical scars. They are always eager to have procedures, tests, and risky operations. A first clue in someone who has possible Munchausen syndrome is when they have conditions that are getting worse for no apparent reason, and they are also not responding as expected to standard therapies. Occasionally, Munchausen's can be subconscious. Sometimes, these patients don't even realize that they are doing what they are, or they don't have a reason as to why they are doing it. While doing research, I found a story about a girl named Lindsay. She had one fainting spell that they associated with an allergic reaction. She ended up spending 2 weeks in the hospital and stated that she fell in love. Once she was out, she couldn't wait to go back. Although she was in good health, she started pretending to have stomach pains in hope that she would be readmitted. She started researching illnesses that would give her the longest hospital stay. Over her lifetime, she presented to the hospital with 12 different fictitious illnesses, including schizophrenia, multiple sclerosis, and epilepsy. At the age of 24, she gave birth to her first child. Shortly after, she was admitted to the mental health unit for suspected signs of postpartum depression. Once admitted, Lindsay stated that she started studying other patients there and exhibiting the symptoms that they were having so she would not have to leave. She admits to knowing that this was wrong, and she felt guilty, but the relief and the tension outweighed the other feelings. In 7 years, she was admitted to 100 different hospitals. Lindsay reported that it was nearly impossible for her to hold a steady job with all of her hospital stays. She also got a divorce from her 8-year marriage and lost custody of her 3 children. The effects of Munchausen started taking a toll on her body. Her veins were scarred from so many IVs. She had radiation sickness from all of her x-rays, and she was just becoming weak. She began to reach out for help, and after a 20-year battle with Munchausen's, she recovered. she hasn't faked an illness for more than 2 years and has regained custody of her children. Similar to Munchausen's, there is also Munchausen's by proxy, MSP, or also called factitious disorder imposed on another. This is often on a child or dependent victim, and generally it is the caretaker or a parent who is causing the illness to their child. They say they are not doing this to cause harm to their child, but they are also just doing it to receive attention and nurturing. In this case, it would not be the child who has Munchausen syndrome, but instead the perpetrator. The victim would be diagnosed with abuse, and there could be criminal aspects for this part of Munchausen's. Providers often struggle to identify the cause of the child's illness. No one is expecting the mother or caretaker because they still appear to be loving, caring, and extremely distraught about their child's illness. The mother or caretaker often lie about symptoms, alter tests such as contaminating urine samples, and falsify medical records. They can even induce symptoms such as poisoning, suffocating, starving, or causing infection. Common symptoms of MSP. Often, the mother or caretaker will report worsening symptoms, but the caretakers are not able to witness at the facility. Conditions and symptoms don't always match the test results, which can be a red flag. Commonly, if there are more than one children in the family, it is not uncommon for more than one of the children to have an unusual illness. Even a death in the family can trigger Munchausen's, such as Mary Beth Tinning. In 1967, Mary Beth Tinning's 8-year-old daughter died of spinal meningitis. She enjoyed the sympathy that she received during her grieving and loss period, which led to what happened next. 1 month later, her son died after he was brought to the hospital. She claimed that he had a seizure, but she was sent home. 2 days later, she brought him back dead and claimed that he had stopped breathing in his crib. Just a few weeks later, Mary Beth brought one of her other daughters to the hospital, exhibiting the same symptoms of a seizure and stopped breathing. With months and years to follow, 5 more of her children had died. After the death of the 9th child in 1985, police grew suspicious. After investigation and interrogation, she admitted to suffocating 3 of the children. Due to the lack of evidence, she could only be charged with 1 count of second-degree murder and spent 20 years in prison. She did all of this because the attention and outpouring of love that she received after the death of a child outweighed her conscious decisions. More symptoms of a child with Munchausen's are inconsistency in the symptoms, inconsistency in testing and lab results. A child may present with symptoms at the hospital that get better there. Once they return home, they become ill again. Blood samples may not match the blood of the child, and traces of chemicals may be found in the blood, stool, or urine. In treatment for Munchausen's and MSP, the priority concern is to ensure safety and protection of the victim or themselves. Munchausen's can be very difficult to diagnose because of the dishonesty in the first place. Once all physical reasons for symptoms are ruled out, then it becomes suspicious that it is self-inflicted. Once that is an option, they are referred to mental health professionals such as psychiatrists and psychologists for evaluation. Although these people are seeking help for invented disorders and symptoms, they often deny the fact that there is a mental aspect to their illness. Unfortunately, the treatment of Munchausen's is very challenging, and the outlook of recovery is very poor. The only meds that can be used in Munchausen's are meds that will help decrease anxiety or depression, which is also very important to monitor to be sure that they are not used in a harmful way. Other than that, The only real treatment is psychotherapy, focusing on changing the thinking and behavior of the individual to prevent occurrences again. In conclusion, Munchausen's has an unknown cause that can be very difficult to diagnose. It can also be very dangerous and harmful to the patient or to the victim of Munchausen's by proxy. Often, guilt and remorse are felt by these patients, but the benefits of what they are doing outweigh those feelings. Once again, my name is Courtney VanErsvelde, and thank you for watching my video.